What is the safe and comfortable weight in kilograms for a person? The body mass index, BMI, is the ratio of a person's weight to height. Weight in kg should be divided by height in meters, squared. This is the BMI, or body mass index. There is small, normal, big, and very big. Save and calculate in your free time. Very big. It's a problem. Pumping out fat is not enough because the appetite will make up for it anyway. That's why many people go to surgeons, even travel abroad for this. No need to be shy there, and it can also be less expensive. In this video, we'll discuss bariatric surgery and talk to a doctor who performs obesity treatment surgeries in Turkish Antalya. Subscribe to channel, ask questions in comments. Obesity and overweight have become a worldwide epidemic. The World Health Organization has been stating this for an extended period of time. Individuals with excessive weight have significantly increased risks of potentially fatal comorbidities, metabolic disorder, diabetes, joint destruction, heart disease. There are many different methods of weight loss: diets, exercises, medications, dietary supplements, but statistics show that only 5 to 10% of patients with morbid obesity are successful in losing weight through these methods, let alone maintaining the achieved results. Mostly these are people with a relatively small amount of excess weight, and the majority of those suffering from obesity do not cope with the disease, especially if it is a severe stage of the disease. Therefore, since the mid-20th century, the world has been trying to fix the situation with the help of surgeons. We are not discussing plastic surgeries such as liposuction and abdominoplasty. These procedures can only make adjustments to the body shape after addressing the main problem, which is excessive food consumption. Bariatric surgery or weight loss surgery is a specialized form of operations conducted on the gastrointestinal tract to achieve significant weight reduction. These operations, in one way or another, reduce the working area of the organs responsible for digestion. When the area of the stomach or intestines contracts, hunger sensations decrease. A person simply does not want to eat more than the reduced gastrointestinal tract allows. Less food enters the body, extra kilograms go away. Of course, despite the lack of appetite, a person may want to eat something out of habit at first. Therefore, the effective treatment depends on self-control. The patient is prescribed a diet. The main thing is that the impact of such operations lasts long. There are various operations that utilize the principle of reducing the working surface of the GI tract. Thick textbooks for surgeons have been written about them. To tell you about them briefly, I met a doctor in Turkey who has been specializing in bariatric surgery for almost 10 years. He performs operations for both Turks and foreigners and is highly respected among his colleagues. Dr. Mehmet Nuri Kasha graduated from the famous medical faculty of Çapatip at Istanbul University and then worked and taught in several cities in Turkey. Made an academic career, has been living in Antalya for the last 10 years. In 2022, Dr. Kashar moved from the large state hospital Antalya Eğitim ve Araştırma to the well-known private Antalya Anatolian Hospital. In this hospital, he encountered us. You assist individuals in eliminating extra weight, and I am aware that there are numerous choices for surgical procedures aimed at treating obesity. What operations, in your opinion, are the most effective, and how do you determine which specific operation to assign to a particular patient? First of all, it is necessary to understand that obesity is a disease and it needs to be treated. Studies indicate that obesity can reduce a person's lifespan by an average of 10 years. Females are at a higher risk of developing breast cancer, and excessive weight can lead to joint issues. Joint replacement, such as hip replacement, poses an additional challenge for patients carrying extra weight. Sugar, pressure, heart problems, risk of heart attack increase due to obesity, leading to increased risk. If a person has a body mass index of 40 or 35 and at the same time has asthma, high blood pressure or high blood sugar, then it is especially recommended for him to undergo surgery. What kinds of operations are available? One of the most well-liked options is gastric bypass, specifically the sleeve gastrectomy procedure. This is a practical and highly effective method. It does not alter the anatomical structure of the GI tract. Food intake occurs in the same manner. Food also passes from the mouth and esophagus into the stomach, but the stomach contracts, it becomes similar in shape to a banana. This method is highly effective. The subsequent form of procedure is a devastating gastric bypass involving shunting of the stomach. This is a combined operation. It consists in the formation of a small stomach with a volume of 20-30 milliliters and the surgical exclusion of the initial sections of the small intestine so that food and digestive juices are mixed only in the middle part of the small intestine, providing a reduction in the absorption of nutrients. Also, the patient's stomach absorption is disrupted, meaning the patient will not have a strong desire to eat. This method is more advantageous for individuals with metabolic disorders such as diabetes. Mini-gastric bypass has emerged as a more widely accepted form of surgical intervention in recent times. It is used all over the world, both in Europe and in America. This operation is shorter in time than the ruinous gastric bypass, the usual stomach bypass, but it also allows for effective weight loss and regulation of metabolic diabetes diseases. There are many types of stomach reduction operations. They are constantly being updated. There are those that are accepted and those that are not. For example, another method is called duodental switch, a duodenal switch, which is also well known in the scientific literature. Obesity is a persistent health issue. Don't forget about it, as it cannot be cured in one go or with a quick fix. A second, and at times a third operation may be necessary. This is because eating habits play a significant role in the process. There is a region in the brain responsible for hunger, including the consumption of sweet and carbonated drinks, as well as alcohol. When you eat a chocolate bar, you can gain weight from it, even if you don't eat the whole bar. Typically, the initial procedure for the patient involves gastric bypass, sleeve resection, and subsequently, additional malabsorptive operations are carried out as subsequent interventions. There is no limit to the variety of revision operations that we refer to as the second and third ones, because our goal is to anatomically transform the structure of the gastrointestinal tract through surgical interventions. Tell me, do you have more Turks or foreigners coming to you? And from which countries do foreigners contact you the most? We have a large number of patients from both Turkey and other countries. Regrettably, obesity is extremely prevalent globally. In Europe, 33% of the patients are obese. We have patients from numerous countries, including Germany, Denmark, England, and Russia. If you carefully look at the statistics of diseases related to overweight, you can notice that there is indeed a huge proportion of people in the world suffering from obesity. Why is preference given to Turkey? Turkey is the preferred choice for a number of compelling reasons. First of all, the serious quality of training of doctors, their work experience, the degree of trust they have earned. Additionally, the cost of medical treatment is relatively more affordable, providing good value for money. Therefore, both in terms of trust level and price-quality ratio, Turkey is a very affordable country for patients. Financial experts have long calculated that a person with excess weight will spend much less money on bariatric surgery and subsequent observation than on lifelong conservative treatment of obesity and serious comorbidities. The cost of the operation in Turkish clinics can be much lower than in other developed countries, and the quality of medical care here is often better. Turks confident healthcare sector in their country, one of the most advanced in the world. Health insurance system, electronic medical record, cities, hospitals, physician training. We discuss Turkish healthcare system differences in other videos on our channel. Dr. Mehmet Nurikashar emphasizes the undeniable quality of medical equipment and materials in Turkish clinics. The specific equipment used by doctors during operations will be clarified during the preparation. This is how prices are determined. The cost of treatment primarily depends on factors such as the length of patient hospital stay and the materials utilized during the surgery. For instance, in the drainage of the gastric sleeve resection, manipulator arrows are utilized, which we refer to as steppers. They were invented by a Russian doctor for whom we are extremely grateful. There are surgical staplers made of titanium alloy, special instruments called trocars, which allow us to enter the canal and inflate the abdominal cavity to free the tissues for surgery. We appreciate the invaluable contributions of these inventions in the field of medicine. Additionally, there are specialized tools available for sealing veins, which, when utilized, result in an escalation of the overall cost. The price will vary depending on the upcoming operation. And ultimately, who ultimately has the final say in determining which procedure to undergo, the physician or the patient? Of course, the patient's desire is important to us, but the doctor also has a vision of the situation and a forecast. There is a mutual discussion with the patient. However, my recommendation is to defer the final decision to the doctor. Since I act as a doctor on my own behalf, I strive to come up with the optimal choice for the surgery and suggest it as a proposal. For instance, a patient comes to me and states, "I would like a mini shunt, mini bypass." He heard it somewhere. "I will have a bypass and there will be no more weight problems," thinks the patient. But he doesn't necessarily need this operation. His body mass index is 40, there are no additional diseases, neither diabetes nor asthma nor high blood pressure. My conscience won't let me do a mini bypass on this patient. I keep telling him that. Why? Because he is young, strong, not very full. And the operation is a rather serious matter, and its result will stay with him for the rest of his life. He will need to take vitamin and mineral supplements for his entire life. The age of people who can undergo bariatric surgery is most often in the range of 18 to 60 years. In certain scenarios, surgeries are performed even in advanced age if there are no medical contraindications to the procedure. There are known examples when bariatric surgeries were performed on 80-year-old patients. Nowadays, obesity treatment operations are most often performed using minimally invasive methods. That is why such operations are considered relatively simple and safe for patients. The scars are almost invisible, the recovery time after the procedure is relatively short. This is another reason why bariatric surgeries are among the most highly sought-after medical services in Turkey for visitors coming from other countries. One of the advantages is that we do not make large incisions. As a rule, patients with a very large liver usually undergo 4 incisions of 12, 10, 5 millimeters. The maximum number of cuts is 5 in overall complexity. If you take care of the procedure, there will be no noticeable significant scars. The seams will be very small and neat. What is the usual duration of the operation? How long does the patient typically need to stay in the hospital after the operation? And when can the patient usually return home or to their hotel? If we talk about the operation of gastric bypass, sleeve gastrectomy, then these are operations that last half an hour to an hour. Usually we hospitalize our patients for 2 nights after the surgery. In other words, we accommodate both our local and foreign patients for 2 nights. After the second night, usually in the morning of the 3rd day, if everything is fine after taking water, juice and soup and receiving dietary instructions from us, patients go to the hotel. If they have a home, we send them home. And if they come from abroad, we let them go home after 10-12 days. There is no harm in traveling by airplane. How quickly does the patient begin to notice the effect of the surgical operation? When does weight loss occur? Gastric bypass, sleeve resection has been performed for many years, and it has been scientifically proven that the operation leads to weight loss. For the first 10 days, this operation leads to a loss of almost 10 kilograms. Then the slowing down of the effect begins. The rate of weight loss is diminishing. Scientific research demonstrates that 40 to 60% of individuals with obesity continue to experience weight loss during the first 6 months, according to studies. The effect of this operation lasts up to 1.5 years, approximately 18 months, depending on age, gender, and metabolic status. If the average weight for a person is around 60 kilos and he weighed 150 kilo, then it will take 1.5 years to reach the normal weight of 60 kilo. Approximately 60% of excess weight is lost in the first 6 months. At this time, rapid weight loss is occurring. During this time, it may be necessary to take vitamin supplements. Whether you engage in more or fewer physical activities, they will assist you in losing weight in all situations and maintaining proximity to your desired weight. Every person is unique. There is no such concept as standard weight. Everyone has their own parameters. Every person is unique. Once you reach a normal weight, everything else depends on you. The first 1.5 years is a critical period when you can improve your habits, reduce food intake, engage in sports activities to make positive changes. If you do this, your regular weight will be maintained for the duration of your life. You can read more about different types of weight loss operations in the article on the website. We provide a link to the article in the video description. And we will also have more detailed short videos about each type of operation that Dr. Mehmet Nurikashar talked about. The video description includes procedure cost, reception, airport pickup, hotel accommodation, and assistance of a language-speaking assistant. Turkey differentiates itself from other countries with its comprehensive approach to patient care, in which each procedure must be paid for individually. The company Healthy Turkey, which exclusively works with verified specialists in both medicine and hospitality, is responsible for organizing such an all-inclusive trip and coordinates all of their work for each patient. Healthy Turkey takes care of everything, from consultation agreements with the clinic and doctor to transfer, accommodation, immigration formalities and translation of medical documents, and even rest between doctor's appointments. The company's website address is on the screen. There is a lot of information about other directions of health tourism. You can use it as a reference material. Feel free to contact this number for consultation. Don't forget to subscribe to our channel and don't miss new videos about medical tourism in Turkey.